Rashee Rice of the Kansas City Chiefs suffered a significant looking leg injury today that actually required him to be carted off of the field against the Chargers. At the time of this video, we don't know exactly what the specific injury is that Rice has suffered. However, it looks like that they are officially classifying it as a knee injury. The position that Rice's knee went into is known as knee hyperextension, and this can be very risky for several structures in the knee, and that's something I'm going to focus on with today's video. Ladies and gentlemen, welcome to my channel. If you're not familiar with me, my name is Nick Gallo, and I'm a doctor of physical therapy, and with my channel, I take a look at sports injuries and I explain them so that they're a little bit easier to understand. I also go over the relevant anatomy of that injury and talk about what that person should expect when coming to rehab. If you enjoy this sort of content and you want to see more of it, please hit that thumbs up and subscribe to the channel because I will be making more of these videos in the future regarding sports injuries, rehabilitation, and other physical therapy related content. Also, if you yourself have suffered a knee hyperextension injury, go ahead and comment in the comment section below. So the play that Rice actually gets injured on is more of a bizarre play in the fact that Mahomes is going to throw an interception, and then as he's trying to tackle the defender right here, he's inadvertently going to make contact with Rice's knee, and that's going to once again place him in that knee hyperextension position. Here I have a model of the knee joint, and so the knee is made up by this femur, also known as the thigh bone, that's going to come down and form the top portion. At the bottom here, we have two long bones, the first one being the tibia bone, also known as the shin bone, and then more laterally or towards the side here, we have another long bone known as the fibula bone, and these bones are going to make up the knee joint. Now, the knee joint has four major ligaments that are going to contribute to overall knee stability. The first one is this anterior cruciate ligament, also known as the ACL for short. As we flip the model medially or towards the inside, we have the medial collateral ligament, also known as the MCL. As we go laterally here, we have the lateral collateral ligament, also known as the LCL. And finally, on the back here, we have the posterior cruciate ligament, also known as the PCL. There are two other really important structures that are located within the actual knee joint. They are the medial and lateral meniscus. These are essentially two pieces of fiber cartilage that are going to be in between those femur and tibia bones. So let's go over the basic motions at the knee joint. The first one being flexion, where the knee is going to bend like this. And the opposite of that is known as extension, where we're going to be straightening the leg like so. Anytime we go beyond the normal value of whether it be extension or flexion, it's going to be known as hyper. So in this case, we see that as Mahomes makes contact with his knee, he's going to place the knee in more extension, and this is known as hyperextension. The normal value for full extension at the knee in the textbook usually is around 0, which is going to be a straight line here. However, in clinical practice, we see that most people often have a little bit of hyperextension. It really just depends on the person. However, when a person's knee is going into hyperextension as a result of a trauma, this is an extremely risky position for the knee, and I'll show you why. So as I put this model into extreme hyperextension, you can see that as I'm doing this, it is stressing this LCL, the MCL, and then as we look in through here, it's also going to stress that ACL and PCL. So this gives potential for a multi-structure injury whenever a person goes into a traumatic knee hyperextension. So it is possible that a traumatic knee hyperextension can damage either one or multiple of these structures located within the knee. Unfortunately, a knee hyperextension is a common cause of an ACL and or MCL tear, but it is important to say that this doesn't always lead to a ligament tear, and there is a grading system for these ligament injuries. I'll go over that in a few moments, but it is important to say that although he was carted off, it doesn't always mean that it's going to lead to a ligament tear. So we know based on the knee hyperextension position that obviously these ligaments are going to be at risk here. It's also important to say that because this is such a traumatic force leading to a direct impact of the knee here, that we want to rule out any sort of a fracture. Now on this model here, I don't have the patella or the kneecap, but it's important to say that anytime you get a direct impact, the bones such as that kneecap, the femur and or the tibia fibula could also be impacted. So it's important that a person is going to get an x-ray to rule out any sort of bone involvement before we start talking about any sort of ligament risk. There are some on the field or in the clinic tests that we can do to determine if we think somebody has suffered any sort of a ligament tear. I'll go over those briefly. The first one for the ACL, the gold standard, is going to be known as this Lockman's test. And so the ACL is going to prevent any sort of anterior motion or anterior slipping of that tibia. So we're going to stabilize the person's femur, and we're going to pull on that tibia. We're going to compare this to the non-injured side, and if we feel laxity, then this makes us think that we have an ACL tear. If we think someone is dealing with an MCL injury, what we're going to do something known as a valgus test. And so we're going to once again stabilize the person's knee, provide a valgus force where we're going from the outside coming in. That is going to stress that MCL. Once again, comparing to the other side, if we feel any sort of laxity, then that makes us think that there is an MCL involvement. The opposite of that is known as a varus test, where we're going from medial to lateral. And this is where we're going to be holding the person's leg like so and providing that varus force. Once again, comparing to the other side. And finally, for the PCL, there is something known as a posterior drawer test, where we're going to be pushing the person's tibia going to the posterior or to the back, because the PCL is going to resist any sort of posterior translation. So there are some on the field or in the clinic tests that we do if these are suspected. However, the absolute gold standard is known as the MRI, and this takes us to our grading system of these ligament injuries. In a grade 1 ligament injury, this is where you're getting stretching, maybe some very slight micro tearing of the affected ligament. However, you're not going to get any instability in the knee usually. In a grade 2, this is where we consider this a partial tear of the ligament, which usually will lead to instability. And finally, in a grade 3, this is of course the worst case scenario, where you're going to be getting a full rupture of that affected ligament. In order to get a good, accurate timetable of when Rice should return, we'll need to absolutely know the grading system. So once I hear the results of that MRI, I'll be sure to update everybody in the comment section. But if it's any sort of a low grade strain like that, he could miss anywhere from about 2 to maybe 4 weeks, depending on the severity and how he is presenting. If it is along the lines of a grade 2 or grade 3, where there is significant instability of the knee, then this is going to be quite a longer recovery. So it really is going to be dependent on that MRI results. And this absolutely dictates how we're going to treat this person in physical therapy. If we get somebody that comes in and they really don't have any compromised stability of the knee, we can start to hit them with that acronym RICE, where R stands for rest, I stands for ice, C stands for compression, and E stands for elevation, because we want to pump out as much swelling as possible. Then when the person is appropriate, we can start to work in full range of motion exercises and progress them to return to sport type movements. It really depends, once again, on how they are progressing in therapy. If they are dealing with something that requires surgery, however, there are surgical precautions, and this can take quite a bit longer. So once we have those formal MRI results, we can absolutely know what to expect when that person comes to rehab and make an accurate timetable. So we wish Rice the best of luck moving forward. We hope it's one of those lower grade strains and not something that's going to take him out for the remainder of the season. Thank you so much for tuning into my video today. If you enjoy this sort of content, I'm going to go ahead and link another one of my playlists so that you can see some of the injuries that I've talked about in the past. Thank you so much again for tuning in, and I'll see you next time.